Right, let's get into that conversation now in studio. Like I had said, I'm joined by Dr. Sultan Matendechero, the Deputy Director General of Ministry of Health. Thank you so much for making time. Day 23 for the doctor's strike. It is getting really dire. I just want to get your comments on the two stories that you've seen, the situation at Mama Lucy Hospital and what Catherine is also talking about, how the situation is quite serious in the country. What are your thoughts coming from a government perspective?
Yeah, so first of all, I think I just want to really say that it's unfortunate that we are in such a situation. You know, a strike in the health sector is not really something that you would want to have, because at the end of the day, it is the very poor people, you know, who cannot afford, as the story has just said. It is the very poor people, the most vulnerable in the society, who end up bearing the biggest brunt. Now, you can see even from the stories that under normal circumstances, when we are working, our facilities are at 100% operations, we lose patients, you know. It doesn't mean that when the facilities are working 100%, we will have everybody going home fine. We still lose some patients. So you can imagine now when there is a strike, what will happen. Of course, you expect that the numbers will go up. And these are people who, in most cases, do not really deserve to lose their lives. Their family members do not really deserve to lose their loved ones. Some of them are mothers who are taking care of families, and then you find that children have now remained orphaned, and it causes a lot of, you know, the knock-on effect is really bad. So one of the things that we are really saying, and it has also come out even in the stories that you have just seen, is that we have very many stakeholders, including the media. We have very many. Actually, everybody is a stakeholder in provision of public health. So I think at this point in time, what we really need to do is to just pause and maybe go back a little bit and tone down on the emotions so that we can have useful conversations towards resolving this strike, because the main players are the least affected. For the sake of those who are most affected, I think it is important that we tone down a bit. We now come and reason together so that we can resolve this impasse.
But as much as you say tone down a bit, this is an issue that is affecting doctors in the whole country, and it has been there for a long time. Let's begin with one of the most contentious issues that the doctors have been talking about is, for instance, the medical intern doctors, and talking about the salaries or the stipend they're getting. And it is being reduced. Give us some clarification on that. What is the actual stance when it comes to the intern doctors?
Thank you very much for bringing that up. Actually, just so that we are clear, for all, you know, purposes, I think it's important for us to be able to see that this whole crisis is about the posting of interns. I think that is where the genesis of this whole process came from. The problem is really about posting of interns. And the situation is that for the longest time we have been, you know, we've been having medical students who undertake their training, and then they graduate, you know. And at the point of graduation, they are qualified, you know. They are qualified professionals, they are qualified doctors, qualified medical officers, qualified dentists, qualified pharmacists. But you see now, it is important that even though you have qualified, you have all the knowledge and so on, then you need to go through a period, 1 year period to be specific, where you will now practice under supervision so that you can now translate the knowledge that you received into the requisite skills without really being a danger to the very patients that you want to treat. So this 1 year period, which is an internship period, will end with the now satisfaction that you are able to do the job independently, and then you are licensed. So you see, at the end of college, you have a degree. At the end of the internship period, you have a license. So the confusion is coming at the point of internship. We have some people who are saying interns are students, because you see, they are undergoing supervision. There are others who are saying, no, interns are doctors, because they have already acquired the degree, and all they want to acquire now is a license. There are others, interestingly, who At one point they say they are students. At another point they say they are doctors. So there is a lot of confusion. And I think what we really need to do is to understand this transitional period so that we can be able to see these interns for exactly for who they are.
As much as they are interns, are
Yes.
they not qualified enough to treat patients as doctors, as much as they're doing the 1 year period, and then there's the license? Of course, there's an exam before that, and then they get their license, right? If I got that right. Then what is the situation when it comes even to the salaries? Because I know SRC is also involved. How much do they earn? Give us the specific figures.
So the interns currently are earning 206,000 shillings monthly. And this is it's a salary that has been provided for interns. And as I said, historically, interns have actually gotten into the system at entry level. And by the time this was being done, there was an acute shortage of doctors. So you'd find that actually these interns are the ones who are doing most of the work in the hospitals. And this actually informed this decision to be able to say that much as they are undergoing some kind of training and supervision, but they are the ones who are offering a bulk of the services, so they are entitled to a salary, you know? Now, things have changed because even the crisis has started because the numbers that we were seeing then have increased. You know, in some instances, the numbers have increased even up to 4 or 5 times.
Right.
You know, and again, apart from now the doctors, you know, other health workers who are also exposed to the same circumstances have come in and said, we also deserve to be paid for internship. So over the years, we have also increased the band so that now we are including clinical officers, we are including nurses as paid internship.
Right.
So eventually what happened is that now we had a very big number of doctors coming out for internship. And we also have other cadres who are also coming in for paid internship. There are also other cadres who are clamoring to say that even us, we want to be included. And so we found that whatever is allocated to pay the salaries is not enough. So for example, now this year, the one that is in contention, we received about 3.7 billion at the beginning of the financial year.
Right.
The financial year usually starts in July. So we received 3.7 billion for interns, for paying salaries.
Right.
Now, that was not enough. And in fact, at that point, we had about 50% of the group ready for posting. So we had to mobilize an additional 2 billion to be able to send this first group to their postings. That was in July last year.
Right.
Knowing that in January, February, we will request for additional funding so that we can post the second batch. Now, when it came to the second batch, we needed 4.9 billion, additional to the 5.7 that we had already used to post half of the batch.
Right.
Now, remember the allocation is 3.7 billion. We have already utilized about 5.7, and now we are requesting for 4.9. So what Treasury did was that they said, we have looked at our fiscal situation, and it cannot allow us to give an additional 4.9 billion. And in fact, you've heard, not from one place, but from many places, it being said that the economic situation is such that for every 10 shillings we collect, we are paying out 7 towards debt. We remain with 3 shillings to be able to do everything else.
Right.
So Treasury advised that we cannot give you any more funding for this year. We can only be able to reassure you that we will give you 3.7 billion for the next financial year, which starts in July. And that's when you can now post these interns. And in fact, make sure that you work within that amount to be able to now take care of the interns because there will be no additional funding.
Right.
So as a ministry, we sat down and we said, but you see, it is not just about paying. It is about also these interns staying at home for very long and starting to lose even the knowledge that they have acquired in college. Because if you stay for too long without trying to exercise and practice and turn that knowledge into skill, then you can easily have it decay. So we said, some of the interns actually came, some of the graduates, they said, okay, for us, we would like to go and start practicing. Even if there's no salary, it's okay, we understand, we can go and start practicing.
And you approved that?
So there was, yeah, of course, there's a provision for such, graduates who want to go and practice. But then they have to commit that we will not require salary during this period. So that one, they are trying to chase some time value so that they can be able to get their licenses, and then they become eligible for employment, and they can also quicken their career progression.
But that's definitely not the case with the majority.
Yeah, but you see now, the majority of them do not have the kind of resources that can allow them to be able to take care of their internship. So one of the stopgap measures that we were thinking about was, can we, because there's an internship program for everybody else, they get about 25,000 shillings to go and do
in different
their
professions.
Yeah. So we said, can we leverage this stipend? This is not a salary now. This is a stipend that's being given. Can we leverage it for those who cannot afford to see if it can be, maybe we put in a case to say it should be increased maybe to a certain amount because this is a special kind of professionals. And SRC now advised and said, okay, if we are to take some on this stipend, then we can be able to allocate this amount. That is how the amount came. It is not that the salaries are being slashed. It is just a stipend, a special stipend being extended to enable them to be able to quickly attain their licensing.
So does it move from the 206,000 to a certain amount of money, or it remains at that?
No, the ones who are earning 206,000, those ones are already in there, continue earning that.
What about the next batch?
Now the next batch, who cannot wait, it is not mandatory. Those who cannot wait for the 206,000 in the future, when the economy is okay and it can be able to accommodate, then now they have something that they can be able to use to now go and get their license.
Don't you think the previous interns, or rather the interns who would be taking in that amount of money, would feel like it's not fair in that particular case?
Absolutely,
because it really is the same thing that they're doing as the previous intern doctors. Do you think then that would be the solution? Because I guess that's what the doctors are striking about, especially the interns.
That's the bone of contention, because the message that's going out there, and that's why I really want to say that we also really need to take time and have a very, genuine conversation around this whole situation. Because, the message that is going out there is that the salaries have been slashed, but the fact is that now that the money is not enough, what do we do? Do we now just say that we wait until July so that we receive our allocation? So these, the ones who require 4.9 billion are queued so that not even all of them will be able to go in with 206,000. And then now that time, there'll be a new batch of about 1,300 who have come in, who will now have to queue again until the next year when another 3.7 billion comes. Or do we look for, now you really have to try and start looking for other alternatives. So how can we be able to work with the situation we have? So number one, there's a stipend that is available for all health professionals. Can we leverage that? There are other initiatives that can also be brought onto the table so that we can see how to be able to take care of this. So with that, the government was able to release 2.4 billion to say, okay, you can send in. This is enough for everyone. If everyone wants to go in early, they can go in. But for those who really want to go in, it will be enough. So they released 2.4 billion. Remember, this is money that has been released within this financial year, which ends in June.
Right.
So what we have done, we have said, okay, we are sending letters to all the interns, offer letters, which they can accept. Now, if they accept, then they can be able to utilize these resources. If we manage to get other additional resources, which we are looking for, then we can also be able to update, to be able to increase their allocation, and they can be paid in arrears.
But what is actually said is that the reduction of the salaries of the interns is down by 91%. Is that factual?
So you see now,
because I'd want to get the actual figure, because we've already talked about the 206,000.
Yeah.
So is it really reduced by 91%, and how much is it for the next batch?
Okay, I'm not very good at calculation, but
like
if
just
you do 9%, it means that 91%
has it actually been reduced?
It goes down to 9% of 206. which is about 20, about how much? I don't know.
I mean, that's math,
But,
yes,
yeah.
definitely. But like the whole situation has the number, you've explained it very well. But has it, the salary that is now given or the stipend, has it gone down by 91%? Because that's going down very down, very low. So what are your thoughts on that specifically? Do you have the specific numbers?
I don't know.
You have to do the calculations.
Calculation, 10% of 206 is 26, is 20.
Okay.
20,000.6. So 9% should be lower than that.
Okay.
But the offer is 90,000.
Okay.
So not 90, 70,000.
Right.
So I think that would be a bit more than 9%. But as I said, I don't know. The calculations, we would need to sit down and do them.
And do a proper
calculation.
calculation.
But of course, it is a substantial reduction.
But what does the CBA actually say, the 2017 CBA, with regards to this whole strike? Because I know that the doctors are also talking about the non-implementation of the collective bargaining agreement for 2017. It's 7 years later. What is the actual situation with that bit? Yeah,
the CBA actually provides for paid internship. And it actually also provides for the salaries that are being paid currently, 206,000, and it has been deposited in court. So it forms part of the legal basis for these salaries. But you see, CBAs in general, yeah, because I also have a history of trade unionism. So I've been a trade unionist. I've been the Secretary General of KMPDU before.
Wow.
And I even negotiated the first CBA, which was signed but not implemented. Now, a collective bargaining agreement becomes an opportunity for the employer and employee to be able to agree within a certain framework without really having to, especially like now in the health sector, without really having to subject now patients to the suffering we are seeing. Now, CBAs are renegotiated every 4 years. And the reason why they have to be renegotiated is because circumstances can change, you see? Now, in this very classical case, we have seen a very big change in the circumstances. The numbers have gone up of the people who need to be hired. The economic situation has also not been very good because of reasons that now are beyond us. But we are told, when we write to Treasury, we are told the economic situation cannot take care of this. So what a collective bargaining arrangement envisions is that we will get to a point where we can relook at the whole ecosystem to see if we can increase or reduce the terms that we have agreed on. So that is the dilemma that we are in, because the CBA actually provides for this, but then the situation, as I gave a background, cannot allow for that to be implemented. Right, okay. Yeah.
We'll get deeper into the conversation a bit later. I want us to just take a short commercial break here on News Center. Remember, the conversation, of course, is on the ongoing doctors' strike in the country, so stay tuned for that conversation.